1 in 5 women suffer from a type of perinatal mood and anxiety disorder, and many are at risk due to societal factors. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Executive Speechwriter with AHA. In this Members in Action podcast, highlighting maternal and child health efforts, Aisha Syeda, Program Manager at the AHA, is speaking with Kelsey Kyle, an RN Care Manager at St. Peter's Health in Helena, Montana. And joining the discussion is Brie MacLaurin, a nurse and the Executive Director of Healthy Mothers, Healthy Babies. That's a training curriculum from the Montana Coalition. The focus of today's podcast is St. Peter's Health Taking Care of You program, a parental support approach for treating perinatal mood and anxiety disorders in the rural communities of Montana. Aisha?
Thank you, Tom, and thank you, Kelsey and Brie, for speaking with me today. To start us off, can you share the impetus of St. Peter's Health Take Care of You program and what it hopes to accomplish?
Yes, thank you for having me on the podcast. I'm Kelsey Kyle. I'm a nurse care manager at St. Peter's Health in Helena, Montana. And I have been a nurse care manager with our outpatient medical group for the past 4 years. I outreach our patients transitioning home from the hospital and also work with our high-risk patients in our clinic. 4 years ago, I noticed gaps in our care with our postpartum population. And the first gap was that many of our patients were not receiving any outreach from our clinic until they attended their 6-week postpartum visit. So the next step that I did was create an evidence-based protocol to start outreaching our patients at 2 weeks postpartum, which also includes an Edinburgh screen. And then I continued to seek out and attend training for perinatal mood disorders and became certified in perinatal mental health. Providers in our clinic started sending me requests to outreach patients that they identified as needing support in the pregnancy and postpartum timeframe. With the support of my leaders, I was able to continue to grow the program, which now includes social work, behavioral health professionals, and 2 nurse care managers. We have also extended our outreach to 4 and 9 months postpartum and receive referrals as patients are identified in the clinic. We hope to provide care, support, and early identification and treatment of stressors, perinatal mood disorders, and substance use for patients and families in the pregnancy and postpartum timeframe. Hopefully, this will lead to healthier families and positively impact the health of the next generation.
Thank you, Kelsey. And Brie, what's the role of Healthy Mothers, Healthy Babies, the Montana Coalition, and how did you come together with St. Peter's Health on this initiative?
Hi, everybody. Yes, thanks for having me on the podcast as well. And Kelsey and I have been working arm in arm for years now on this issue in our community. Before I was the leader of our state's nonprofit that's focused on pregnancy and early childhood health promotion, I was a home visiting nurse. So I was visiting families, homes of pregnant women and children ages 0 to 5. And like Kelsey, I experienced huge system gaps. Myself, I had experienced a lack of appropriate care for my own experiences as a mom. And so I was somewhat vocal in that. And so I just seemed to be the person that was always called for these issues. And it seemed like there needed to be a better system. So than just relying on one person and their experience. So after I transitioned to the director of the nonprofit, I think the angle that we've taken is twofold. One is helping organize, gather, research, and create a resource and referral network, helping connect community-based supports with the medical community, knowing that primary care, can't always do it all, especially in the short amount of time. So if we can establish relationships and links within experts in the community that are familiar with this, it can be this really lovely partnership between these community partners and the medical community. And I believe that another lever that Healthy Mothers, Healthy Babies can use is our voice and our ability to advocate. So we've done things like meet with the medical director and the CEO of the hospital, talk about the need. The St. Peter's Health has been really generous with supporting training that benefit all of us. And so we continue to communicate about the progression of the investments that the healthcare community has really brought into the workforce development. And through that, we're seeing lots more available options for women and families when they are struggling with perinatal mood and anxiety disorders.
Thank you for that overview. Can both of you share some of the outcomes of your program and the impact it has made on patients? Kelsey, did you want to start first?
Yes, I will start. So our Taking Care of You program at St. Peter's Health, in the past year, we have served over 300 patients in our community, and we help patients connect to the services and supports that they need, not only within our own organization, but also out in the community as well. We identify social determinants of health and stressors, and usually start with our housing and our basic needs and build up from there when helping support a family. Another success that we've had is that we now have a working relationship with Child and Family Services and receive referrals directly from them. So anybody who is pregnant or has a baby under a year of age can be referred to the program. And then the approximate time of working with the team in the program is about a year. We can extend that as needed, case by case, but we found that so far most families, then by the time we worked with them for a year, they have some really good supports established, and we're kind of more in the background. We're not as in the forefront as we were in the beginning. And then in the past year, with our work with Child and Family Services, we've had patients successfully complete treatment plans, be reunited with their children and actively parent their children, and then have their CPS cases dismissed, which is just an amazing piece just for the health of that parent and that person, and then also the health of the kids, and keeping kids and families together is a really big goal of both Child and Family Services and our program.
Brie, did you want to add anything to that?
Well, that was beautiful, Kelsey, and I agree about those incredible outcomes we're seeing. I think just to add something that hasn't been said is building on this need to have a continuum of care and awareness in the community about that the postpartum period doesn't end 6 weeks after pregnancy, and there needs to be thoughtful conversations about how we ensure that women and their families, and even men, as we're learning that this can affect fathers as well, there is awareness and conversation at least for the whole year after birth. Some of them most severe complications of pregnancy are mental health conditions, including suicide and substance use disorder, and a lot of those complications aren't emerging until several weeks to several months postpartum. And so part of the outcomes we're seeing is an openness and awareness to continue the conversation about ensuring that families have the support they need when they need it. And I do believe that having a really good network and a really good relationship with the medical community is unique, and it's difficult to establish just because of the nature of the work, that they're busy, it's fast paced, it's hard to get away for an hour and a half meeting every week or so if you're a clinician. I mean, the fact that St. Peter's Health has committed to being part of these conversations and have allowed staff to lead some of this work in our community has allowed us to start to tackle some of these complicated continuums that we couldn't do without them. And I think that the impact will be new systems of care in ways that healthcare hasn't been delivered. For example, we're beginning conversations about what it looks like to ensure pediatricians have knowledge and training around maternal and perinatal mental health, and how we make sure that, where parents are is where they're getting their support, even if it's not where they receive their maternity care. And those outcomes will result in lives saved, honestly.
Those outcomes, those learnings, thank you for sharing those. Those were wonderful. And along with that, what were some of the challenges or pleasant surprises throughout the process of initiating this program and working with community members and working with the medical community?
A challenge would have been early on in my work in identifying patients that had depression or anxiety or perinatal mood disorder. It could be difficult to encourage someone to connect to the mental health resources they need, including therapy and psychiatry and even just consults. And when put really gently and thoughtfully, I had many patients say, "Oh, I'll think about it, but I'm not really sure that this is what I need." And went with our program when we started shifting to address the social determinants of health first and really address all those stressors and help just provide support around that and have success around successful connection to resources needed. Families built that trust with us, and then I've been way more successful in getting people connected to the mental health services they need, or even work on their recovery from substance use. And it makes sense, because if you're super stressed about your housing or where your food is coming from, your brain just cannot be in the space to heal and be able to receive those higher level services that really overall eventually impact your health and well-being. So that was a challenge. And then surprises would just be our community is just incredible, and I've been able to make many connections with different organizations that provide care for women and families in the perinatal period, and just the outreach of help and support. There's times when I identify a need for a patient and my own organization isn't able to fulfill that, but I reach out to other people in our community and have an outpouring of, "Hey, here's where I can help you get this for this family." And we just work together as a community team really well, which is amazing and really needed for you. It can't be one person doing this. It has to be an entire team and an entire network of system that's not only within a healthcare organization, but then out in the community, and all these pieces working together to provide success for our families. And then the thing that was also somewhat surprising is just the gratitude from the patients. And I every single week receive thank yous from people, just that they appreciate the help and support. Navigating through it can be an exciting time to have a baby, but it can also be a really challenging time. So just being able to wrap support around our patients and help guide them through, it's incredibly rewarding to do that every day.
I love that you added that you can see that this is actually impacting the patient's experience because they're telling you that it is. So I love that there's a process to include that patient experience element into your work. Brie, did you have anything to add to that?
I think I could just add a couple things quickly. The beginning of some of our community organizing, this community team that Kelsey mentioned, was an awareness that we had a very limited number of professionals that had specific training on these conditions. And it was a really pleasant surprise to see that when we laid down the goals to increase professional development, build our workforce to better serve this population, the willingness and the commitment to all of the training that's been happening in Montana has been incredible. For example, we hosted a training last fall, And we had an average of 175 people on Zoom all day long for 5 days. And that's Montana, and there's really not that many of us here. So that just demonstrates it was a pleasant surprise to see, even during the pandemic and all of this, time where we're looking at our screens, we still had that many people committed to building us up in this way. And another pleasant surprise was, in the terms of community teams, some of the moms that I've interacted with as well, when they learn about what we call the Maternal Mental Health Task Force, which is a group that Kelsey facilitates and that Healthy Mothers, Healthy Babies is a part of, they say things like, it brings me so much comfort to know that this group is in place and that there's professionals talking and organizing for this. I never realized that when I was struggling that there was people that were considering this a problem and that we're thinking about it. And that brings me great comfort to know that this is in our community. And that's a pleasant surprise and a huge motivator as well.
So what's next for both of you? What's next for this program or the partnership that St. Peter's has with Healthy Mothers and Healthy Babies Coalition? What do you hope to accomplish or what do you hope to grow into for your community?
One thing that I've identified as a need for the next steps, and Brie touched on this a little bit earlier, but my program at St. Peter's is meant for pregnancy through 1 year postpartum, and really providing that wraparound support and acknowledging that the postpartum period, extends past 6 weeks, and it can even be a couple of years out after having a baby before, people feel like they're back to themselves and normal too. But also continuing with our community connections and having programs then to carry these patients and families through the next stages of early childhood, and connecting into knowing that the 0 to 5 year range is really critical, and providing support for families, and just having other programs and connections to continue that same wraparound support up until the children start school.
And Brie, what about for you?
I hope that through this work, I love the title of the program that Kelsey and St. Peter's Health have started, Taking Care of You. And I hope the phrase taking care of your baby is taking care of yourself, and phrases such as that become common language, and we really kind of tip the balance, and it's more common to really talk about the fact that at least 1 in 6, maybe more, women at some point in their pregnancy and postpartum will experience a perinatal mood and anxiety disorder. And that's a lot, and it's okay to talk about it. And there will be a place for survivors at the table to help make decisions, and also help with policy and program allocation, like Kelsey was saying, making sure that there are supports in place for families when they need it. And I think we're getting there. And I'm just really curious with, the pandemic and all of us moms working and all of the challenges we've all experienced together over the years, or the year plus, if that will have any impact on this conversation and kind of just the raw truth of what we've all been through, and if that really creates some ripples that we see in all of our systems on how we do support moms at whatever phase of parenting they're in, but especially in the most vulnerable, this pregnancy and first years. So
thank you, Kelsey and Brie, for sharing all the great work you're doing to address perinatal mood and anxiety disorders in Montana. Your work highlights how partnering with clinicians and stakeholders in your community can lead to better outcomes for mothers and families. For more podcasts, education, and additional tools and resources to improve outcomes for mothers and babies, visit AHA's Maternal and Child Health webpage. Thank you for listening.